Hi, my name is Dr. Ganary Dabiri, and I'm a board-certified dermatologist working at Kuchnir Dermatology here in Milford, Massachusetts. And today I'm going to discuss some commonly asked questions that I get in clinic. What's the difference between filler and a neurotoxin like Botox? Our face tends to lose volume as we get older. So we lose the fullness and the youthfulness that we once had. Filler is a substance that's injected beneath the skin to revolumize the face and create that fullness again. Because we're able to revolumize the face with the filler, you do get a more youthful appearance, as well as the fact that this can also aid in decreasing some of the wrinkles that you formed because that skin is more full and more plumped. Neurotoxin, like the trade name Botox, is a neuromodulator. And what that means is it's injected into the muscle directly, so it can bind at the neuromuscular junction. That's where the nerve and the muscle kind of meet to activate a muscle. And so what Botox does is it binds at the nerve endings, paralyzes the muscle, relaxes the muscle, so you're not able to make facial expressions and etch in your wrinkles. As we get older and we smile and we make expressions with our forehead, we etch in lines. And while we can't completely stop those lines from getting etched in, we can absolutely have them be softer as we get older. And that's the difference between a filler and a toxin. Do over-the-counter anti-aging products actually work? The short of it is no, unfortunately. Because over-the-counter cosmetics are not regulated by the Food and Drug Administration, the FDA considers those things as cosmetic, and they're not regulated the way a prescription topical medication would be. So companies can create creams and lotions, and they can essentially say whatever it is that they want without having any clinical data to prove it. However, some people do feel that when they use these anti-aging products, they are seeing a difference. And that's because any skincare regimen that you do for your face, where you're bringing back the moisture into your skin, you're consistently doing things to maybe take away the toxins from the end of the day, you're washing your face, you're remoisturizing, all of those things bring back our skin barrier function. And what's a skin barrier function? Our skin is in a beautiful, tight basket weave, and as we get older, that tends to loosen up a little bit, our skin sags, and we're not able to keep the moisture in as well, so our skin gets dry. So the products that you put back onto your skin are then able to bring back some of that moisture that you lost throughout the day, which gives the appearance of a more glowing, youthful skin. What is a good daily skincare regimen? The best skincare regimen, I think, is the one that's the most minimal. And that is you need a good sunscreen, SPF 30 or higher, a prescription strength retinol, and we'll talk about that in more detail in a second, a good moisturizer that feels good on your skin, and of course, don't smoke. So sunscreen, of course, is important because sun ages your skin, it degrades collagen, it creates imperfections on the skin like sunspots and pre-skin cancers, and of course, skin cancer. So wearing your sunscreen daily and making sure that you're reapplying it every 2 hours is one of the best ways to protect your skin on a daily basis. Because we lose moisture throughout the day and our skin can't keep the moisture in, finding a moisturizer that works for you would be important to bring back that moisture that we lose throughout the day. Prescription strength retinoic acid, commonly called retinol, is important because that's a topical vitamin A, and topical vitamin A's are one of the only products that can actually rebuild our body's collagen, and it can cause reversal of the sun damage that we get throughout the day. And of course, don't smoke. Smoking itself degrades collagen, and the smoke itself can constrict the small vessels that feed our skin. And when that happens, it creates a more dull skin, it kills off the collagen, and our face dulls, and we wrinkle. Do lasers actually work? And that I will enthusiastically say yes to. Lasers are by far one of the most important inventions that we've had in dermatology. Lasers are effective at reducing redness on the skin, so patients that suffer from medical conditions like rosacea are able to have the redness on their face removed. Of course, it removes unwanted hairs. It can rebuild your body's collagen and decrease wrinkling. So yes, lasers work. Another question that I'm frequently asked is, do I really have to have a full body skin exam once a year? And I enthusiastically say yes to that. Who better than a board-certified dermatologist to look at every mole and every growth on your skin to determine if there's a skin cancer there or not? Melanoma and other forms of skin cancer are the most prevalent forms of cancer that we have. And all it takes is a board-certified dermatologist to look at your skin, find it, and take care of it for you immediately. Melanoma accounts for 7,000 deaths in the United States every year. And if we can avoid even one death by just a full body skin exam, then of course everyone should have a full body skin exam every year.